Now, thank you, Hindi team. Now we are beginning the English session. Thank you so much. Now, today is our 1463rd day of continuous webinar. Thank you all the faculties and participants for your uh, participation and your knowledge. And today we got Dr. Mini Mehta. She is PG in homeopathy. She had done her PG in London. She had done certified course in oncology and currently posted as a palliative care physician in Rajiv Gandhi Hospital, New Delhi. She's her specialized areas is holistic medicine, integrative oncology, supportive care oncology, and she working as a faculty in London College of Homeopathy and wellness consultant as Star Wellness Center Tilak Nagar, and she's treating all type of chronic diseases and allergies, and consultant working as a consultant in Bhagwan Mahavir Hospital and Vardhaman Jain Hospital. She got many awards. She presented many papers in nationally and internationally. And today's our topic is role of homeopathy in raising immunity. Thank you, Doctor. You are welcome to IFPH, and thank you so much.
Thank you very much. So today my topic is a very popular thing with homeopathy, that homeopathic medicine is used to raise immunity. Homeopathic medicine is famous as a medicine which works on immunity. So we learned in the previous session, I was listening, we learned how to select a remedy and how to choose remedy. But these are the ways how we select the remedy and approach our patient. But what happens and what does this approach do to the body, that body becomes healthy or the patient gets rid of the pathology, patient starts getting better? What happens inside the body? What does this medicine do in the body? So that's what we would like to read and try to understand. What does it do to our immunity? That the things which you were susceptible to so much previously, now you are your immunity is increased towards that. Now you don't get sick with those causes, those ailments. Those ailments no more bother you. Homeopathy was born as an experimental discipline, as can be seen from the enormous amount of homeopathic data collected over more than 2 centuries. The, the cardinal principles of homeopathy include law of similia, law of simplex, law of minimum, doctrine of drug proving, theory of chronic disease, theory of vital force, doctrine of drug dynamization. Many times we feel very much entertained by the ways we select medicines on the mental rubrics or keynotes, but the actual things which we should be we should have clear understanding of is the law of similia, law of simplex, law of minimum, doctrine of drug proving, theory of chronic disease, theory of vital force, doctrine of drug dynamization. These are the things we, even if you get bored with this name, you need to keep on reading it again and again. Every time you will understand it in a much better way. So we don't catch diseases, we create them by breaking down the natural defenses according to the way we eat, drink, think, and live. What is health? The homeopathic definition of health is the freedom to adapt to change. That you don't fall sick for long. If you change your environment, you came from the heat to some cold place, you will sneeze twice and you are better. You're not going into a chain of sneezing or attack of sneezing. You just sneeze and now you are adapted. A healthy person is able to adjust freely according to changing circumstances. In health, we live and act and resist without knowing it when we are in health. While in disease, we live बहुत लोग हैं, there are so many people who are living with chronic diseases, they're suffering, but they have made it a part of their life. In disease, they live but suffer and know ourselves in conscious or unconscious exaggeration that we are not well. Homeopathy believes that there is an existence of an essential force in every living organism, which maintains harmony of the function and also differentiates the living from the dead. The vital force determines the state of health in that living organism at mental, physical, and spiritual levels. Susceptibility in organism, mental or bodily, is equivalent to state. A state involves the attitude of organizations to internal causes and to external causes, circumstances. Susceptibility, by susceptibility we mean the general quality or capability of living organism of receiving impressions, means the power to react to stimuli. Upon it depends all functioning, all vital processes. Oh, something happened.
Actually, are you sharing the slides?
Yeah, I was.
No.
See that?
No, I couldn't see that.
Okay, okay. That's what I want.
First, I have seen
Okay.
before
Initially it
beginning
was
the
visible,
session. Then I
then it.
thought maybe you are first talking, then
No,
you will
no, no,
share.
no, no, no. No, no, it's sharing.
Okay. Messages are coming.
Okay.
I thought maybe. Okay.
Upon it depends all
Not it,
functioning.
not it
The
shared, but
power that not again, you're not able to see?
no. Anyone can see? No.
Okay. Let me check. What is the problem?
No.
Now,
Yeah.
can
Started.
you
Correct. Yeah, now started. Susceptibility. Yes.
So susceptibility, we mean the general quality or capability of the living organism of receiving impressions, the power to react to stimuli. Upon it depends all functioning, all vital processes, physiological and pathological. It can be linked to certain events such as always getting ill after being exposed to harsh cold wind or suffering a stomach upset after being embarrassed about something. Or it may be the result of our living conditions. Like anyone living in damp house is likely to experience upper respiratory tract symptoms after a while. Although for some of us it will be sooner rather than later. Susceptibilities can manifest on any level, mental, emotional, or physical. Like, I would like to share when I was, I'm working in a hospital. So initially they had their administration office in the basement. So there, the MD of the hospital, he was always having sinusitis and cold. He used to take medicines. He used to tell that whenever he enters his room, that time only he gets the attack of this. So that area, that basement was damp because lot of work was going on. There was kind of dampness. So only he was the person who was affected in such a way. Rest all people were managing it well. So this is how susceptibility matters. And on mental level, like, sometimes you will see that we go to some places where there are a lot of beggars. So some people feel a lot about them and this suffers their pain. You will find these people, they will be better with causticum. And some people, they don't feel anything listening to the stories or looking at people's condition, beggars or poor people. So this is the mental susceptibility. The homeopathic definition of health, the freedom to adapt to change. A healthy person is able to adjust freely according to changing circumstances. Now we should understand the four humors. Body is made up of blood, phlegm, black bile, yellow bile. If you had too much or too little of them, you became sick. So there were theories before the Myson theory of homeopathy also, that there are few certain things in the body which need balance. Like each humor linked to certain characteristics. Like our miasms have certain characteristics. Example, someone with a fever would have a temperature which caused the skin to go red. This was interpreted as having too much blood. Each linked with season also. Like phlegm caused by cough and cold in the winter, black bile was linked to autumn because this is when a lot of Greek would get diarrhea. Like, you would have heard that, in Indian system of medicine like Ayurveda, they have a food regime for every season, because in every season, like in a certain kind of season, like in rainy season, phlegm could be raised. So this kind of food should be eaten, and this kind of food should not be taken. So there is a lot of preventive precautions in Ayurvedic system which helps in balancing this before getting sick. Linked to personality, someone who was quick tempered was described as choleric. So, so we can see that he is suffering from excess of yellow bile. Depression was linked to black bile, melancholic. So it was suggested that illness was caused when the humors, miasms, or vata, pitta, kapha in Ayurveda were out of balance. To be healthy, you had to make sure everything was balanced. Way to do this would be expanded by Galen during the Roman period. So means what a medicine should do. A medicine should be able to balance all these humors in the body, all the miasms in the body, so that a person should have a good susceptibility, good immunity. Humors, if you would like to understand more, like blood. If blood is more, disease of blood would include heart disease, angina, nosebleed, anemia, diabetes, skin disorder, acne. And to combat this heat, person should eat fruits, cucumber, and bloodletting was done at that time. Black bile, disease of black bile would include constipation, syphilitic, black bile syphilitic, constipation, shaking and tick, damage to nerves, stomach ulcers, patient won't eat. So it was removed by, emetic and laxatives, it was removed excess black bile. Yellow bile people, they used to suffer from gallstones, migraines, and swellings in the body, and it was also removed by purgative. Woman and vomiting. There are so many therapies in Ayurveda and naturopathy. They do it. And phlegm, if phlegm is more in the body, it is imbalance. Disease of phlegm would include cough, cold, asthma, bronchitis, and disease of lungs. When you find that body is cold to touch, cold sweat is there, body lacks heat, then it was come back with something warm, which used to, create some heat in the body, like hot pepper used to be given into the medicines or food. To accomplish this, the physician must know that susceptibility implies and includes affinity, attraction, desire, hunger, need, that these all exist and express themselves normally as states and conditions in every living being, but that they may become morbid and perverted and so cause disease, suffering, and death. Physician knows also that susceptibility implies the existence of wherewithal to satisfy susceptibility, to supply need, hunger, desire, affinity, attraction, and he knows how and where to find the necessary modifying agent. Like, when somebody is sick, how do we take a case? We ask, our important questions are, how is your appetite? What do you crave for when you are sick? What do you crave for when you're healthy, and what do you crave for when you're sick? What do you feel like? What do you want when you're sick? What thoughts are coming into your mind when you're sick? So all these things are very important for us also to select our remedy. If the physician knows how to modify susceptibility in such a way as to satisfy the requirements of the sick organism and bring about a true cure, then is he a physician indeed. Since cure consists simply in satisfying the morbid susceptibility of the organism and putting an end to the influx of disease producing causes. Another factor that affects our reactions to situation is suppression. Like somebody is taking uh, steroids, somebody is taking some painkillers, somebody is taking anti-allergic, somebody is using topical ointments. Suppression means stopping or limiting an action. Frequently, we limit the vital energy in our body by the use of conventional cures. Example of effect of suppression exists from the development of asthma in children whose eczema has been suppressed by steroidal creams to breast lumps which are believed to be correlated directly. The best example to prove that the law of cure, which Hahnemann name is indissolubly connected, be indeed a universal law of nature. The great prophylactic of smallpox, with which Edward Jenner name is forever bound up, was known to many as a thing of accidental occurrence. But he traced it to the source and applying artificially an agent that had previously exercised its beneficial action on limited number of individuals without their wish or will. So law of natural cure, similia similibus curantur. A weaker dynamic action is permanently extinguished in the living organism by a stronger one. The artificially made is always stronger one. If the latter, which is different in kind, is similar to the former in its manifestation. As every disease, not surgical, depends on a peculiar derangement of our vital force in sensation and function. Again, we don't catch diseases, we create them by breaking down the natural defense. How do we break down the natural defense? According to the way we eat, drink, suppress, think, live, or treat ourselves with medications. So, how does our natural defense work? Homeopathic medicine support our natural defense mechanism. Let us know how. So see, this is a normal function, normal health. When normal function is sufficiently disturbed, the body will react in ways to set itself right. Inflammation is the most basic of these reaction states. For observable aspects characterize inflammation, redness, heat, pain, and swelling. When tissues are injured or irritated, the cells will secrete chemicals such as histamine, like you ate something and it created a reaction in your body and the cells got irritated, it will secrete histamine, trainase, kinase, and produce some reaction to save your internal body, but you will take anti-allergic and suppress it. These chemicals cause local blood vessels to dilate, bring more blood into a disturbed area by the when there is fever, then also it is bringing a lot of blood to the diseased area or to work on the immunity. And during this urticaria and everything also, these chemicals cause local blood vessels to dilate, bringing more blood into a disturbed area. They cause the blood vessels to become more porous so that you get nutrient-rich blood. Fluids, oxygen, white blood cells, and other immune factors move into the disturbed area to heal. But it takes some time. You can't imagine that you have got a reaction or urticaria and it should subside there and then. Nothing can heal suddenly. The way it has come, it will go off, it will fade off slowly. So you can see this chart and you can understand how our body works. The body may stimulate the immune system to create a fever. Fever is our friend to burn out the toxins. The toxins may be eliminated through the lungs or bronchioles, causing a large amount of phlegm to exit these areas. It might eliminate them through skin, causing breakouts, or it could eliminate them through the colon, in which case mucus, old feces, and food that hasn't been eaten for quite a while may be eliminated. These are just a few ways the body heals itself. That's why, a lot of doctors you would have heard that when they're treating a chronic disease, they give one dose or three doses, and then they tell the patient, don't do anything if you get a fever. Let it pass. Don't do anything. It is a good sign if you get loose motions after this medicine. If you get a cold, catch up a cold after my medicine. Because this is how something which was stuck in the body is moved out through the body by, formation of mucus or feces. No one knows what a cold is today. A cold is the body's way of eliminating toxins, which it does by increasing the mucus from the mucous membranes in order to free the toxins. Toxin elimination is imperative in order for bodies to stay healthy. Disease reversal is also imperative in order for the body to cure a disease. Homeopathy aims to cure by treating the patient's totality of symptoms, which are mediated through patient's vital force. And when you select the right totality of symptoms and you are able to select the most similar medicine, it is going to support this defense mechanism of the body, this inflammation, this essential inflammation, which will kick out the toxins out of the body through fever, mucus, diarrhea, or anything. Hering's law of cure is considered important to the philosophy of homeopathy and possibly other complementary therapies such as natural therapy and acupuncture, because through this law only we observe how our medicine is working. Is it working in the right direction? So direction of healing we should know. It is symptoms from top to downwards, symptoms disappearing in the reverse order of their appearance, symptoms from within to outward, symptoms from more to less important organ. Like if I'm treating your heart disease and your heart disease is getting better, but you're getting skin symptoms. Okay, so this means medicine is working fine. Or if I'm treating you, some your new symptoms are getting better and old one are coming out, we are going in the right direction. Okay, so like we have treated asthma, some eruptions have come out. So within outward. Professor James Ewing of Cornell University Medical College, he wrote about immunity in 1909, said that effort to produce passive immunity against the various infection by means of sera may fail in spite of destruction of all bacteria present in the body by reason of endotoxins thrown out in the process of bacteriolysis resulting from serum injection. The action of endotoxins of all kinds is similar. There is reduction in temperature but an active regeneration of organs, a status infectious. Thus, sterile death is produced where cultures from the organs and tissues show that the bacteria in question have all been destroyed, but the animal dies. This problem of endotoxin is that present the stone wall of serum therapy. Professor Ewing cited that the case of a patient who received injections of millions of killed gonococci for gonococci septicemia, the temperature came down normal, but the patient died. He continues, an animal whose serum is normally bacteriolytic may on immunization lose this power, the bacteria living in the serum but not producing symptoms. Thus, a rabbit serum is normally bacteriolytic to the typhoid bacillus, but the rabbit is susceptible to infection. If, however, the rabbit is highly immunized, the serum is no longer bactericidal. The typhoid bacilli living in the serum, but the animal not being susceptible of infection. The animal dies. It seems therefore that the effort must be made in the future to enable the tissue and the bacteria to live together in peace rather than to produce a state where the serum is destructive to the bacteria. So these are strong and significant words from the highest authority on pathology in America. In the case cited by Professor Ewing, we see the destruction, partial or complete, of susceptibility of normal power of the organism to react to the stimulus of either the sera or the bacilli. In the case of total destruction of susceptibility, death followed. Listen, in the case of total destruction of susceptibility, death follows. This is what is happening with vaccination. Vaccination is still little bit limited with the humans, but they're doing a lot of vaccination with the animals, with the dogs especially. So a lot of dogs are getting, life-threatening diseases. Their bones are deformed, their liver is getting destructed, they're getting cancers because they are being vaccinated so much. So that their susceptibility has gone so down, so bad. The condition of the patients in whom destruction was only partial may be better imagined than described. A rabbit or a man whose fluids and tissues are in such a depraved or vitiated state that typhoid or other virulent organisms live and thrive in them without producing symptoms, and who will no longer react to powerful serum, is not in a state of health, to say the least. So susceptibility as a state may be increased, diminished, or destroyed. Either of these is morbid state which must be considered therapeutically from the standpoint of individual patient. Like, when some patient comes into my clinic, if it's a child, how look, I just look for the scar of the vaccination. If it's a big scar, this means the susceptibility is good. If it's a faint scar, means susceptibility is diminished. And no scar, so totally, gone case, not taken vaccination. No reaction done. Either of these is a morbid state which must be considered therapeutically from the standpoint of the individual patient. Morbid susceptibility may be regarded as a negative or minus condition, a state of load resistance. One man catches scarlet fever from another man, but catches it because he is risk minor to the disease, which to him alone is risk major. His neighbor does not catch it, his friend passes it by as no concern of his. It is the first man's foible that it is the prime reason of his taking the complaint. He is a vacuum for its pressure. The cause why he succumbed was in him long before the infection appeared. Susceptibility to a disease is sure in the individual or his race to become that disease in time. For the air is full of diseases waiting to be employed. The kind and degree of reaction to medicines depend upon the degree of susceptibility of the patient, and that the kind and degree of susceptibility in any particular case or patient depends largely upon how the case is handled by the physician. For it is in his power to modify susceptibility. Indeed, this power to modify susceptibility is the basis of the art of physician. Homeopathy believes that there is an existence of an essential force in every living organism which maintains harmony of the functions and also differentiates the living from the dead. The vital force determines the state of health in that living organism at mental, physical, and spiritual levels. The germ theory of disease is the currently accepted scientific theory for many diseases. It states that microorganisms known as pathogens or germs can lead to disease. These small organisms, too small to see without magnification, invade humans, other animals, and other living hosts. Whereas homeopathy believes that germs are the end product of disease, not the cause of disease. Homeopathy has stood the test of time dealing with various epidemics in the past, and also it has showed its efficacy in controlling morbidity as well as mortality in the epidemics in the past and also the present scenario. Example, belladonna against scarlet in 1820, veratrum against cholera, anal sulfur against measles. Preventive use of homeopathy was first applied in 1801 during an epidemic of scarlet fever in Germany, where Hahnemann prescribed a single dose of belladonna as the genus epidemicus to susceptible children in the town with 100% success. Some available data from olden days reveal the prophylactic success of belladonna for another epidemic such as scarlet fever in 1820s, with only 7.5% of the 1646 children who were given the medicine remained unprotected. A concept that emerged from homeopathy is the application of nosot, remedies prepared from actual cause of illness, that is microorganisms or byproducts, as isoprophylaxis to treat the same condition. It is somewhat akin to conventional vaccination, not the same, although the preparation is made in the homeopathic manner of potentization with serial dilutions and shaking at each step. It is necessary to rethink about the strategies and national policies which are trying to achieve success over these epidemics. By only relying on investment made on hugely infrastructure-driven, highly cost-intensive healthcare services, clear decisions should be made about the use of community-based, socially acceptable, low-cost and gentle medicine like homeopathy and knowledge in the prevention of diseases. And this approach is the need of the hour. Adoption of integrated approach in the current scenario can help achieve all the above with the case. Thank you very much. This is what I wanted to share. This was all about immunity. Any questions?
Yeah, we have 30 more minutes. I think
actually
okay.
Do you have any questions about it?
Participants, if you have any questions regarding the subject, you can ask. Please come forward. We have,
because you can have questions over it. Because this is what we discuss. What does your medicine do? What does homeopathy do?
Yeah.
You want to understand it with any case example or anything?
Yeah,
Anything you were confused?
that will be nice if you are explaining with the case. Anyway, someone
Like, what happened during the epidemic? I will tell you. There were a lot of people who got fever, and they started suppressing fever. When they keep on suppressing fever, again and again, the liver gets hurt. Okay. Then what happens? Again, they were taking Dolo 650, so their CRP level was high. Why? Because body will heal only uh, through inflammation. It wants
uh-huh.
to create inflammation, but what you were doing, you were suppressing the inflammation, whether it was important or not. 100 fever you are suppressing, 102 fever you are suppressing. Nobody dies with 102 fever. But there was such a fear created in the environment that people were
Uh,
suppressing even 99. So
exactly,
it was
exactly.
not, it was not letting that essential inflammation to work. So people were suffering more with nausea and vomiting. So again, more medicines they were taking. They were taking uselessly augmentin everything, which was killing the essential bacteria in the body also. That some people were just immediately after taking augmentin, they were developing rashes at the back, big urticarial rashes in the body. Oh, this is also COVID, form of COVID. Stupid people, you had this simple fever and then you complicate it with another disease. Artificial, you created artificial diseases due to drugs in your body. So now you have a complex disease syndrome in your body, which we have read in homeopathy. So what they did during the COVID time, lot of people had a complex disease syndrome which they were treating in a very stupid manner. And then later on, when the vital force works, what stops vital force to work from steroids? They suppress the vital force from the steroid, so whatever it is doing, it should stop doing. So they were having fungal infection. So this allopathic conventional medicine, they don't have brain. It's a, they're just running without brain. What they're saying, they're like robots. They can't think. So this is how lot of people died. And before COVID also, I will tell you, these people plan what I saying. These people plan for every August. They plan from the April. Because in India, every August, people will suffer viral fever
Mm-hmm.
according to their own susceptibility. So they at one time they were creating dengue, and dengue they were giving their they were suggesting kind of platelet transformation transfer, and lot of treatment. People died, and they said, oh no, we should not transfer these platelets. And then they got chikungunya with us, they got swine flu with us, and every treatment was not required, and they did it, and a lot of people died. But this fever will come every time in the August in India. This viral fever will come. This is adaptation problem. So people who had fears in their mind had bile choleric people, fear of death, liver problems, diabetic. If they will take unnecessary medicine, they will suffer for a longer period. So if you'll add fear of death to them, so they were dying out of fever and wrong medication, swine flu, Tamiflu. So what these Tamiflu and this all these they were giving a lot of medicine at CQ. So what they attack the body in another way. So when they were doing their cultures, blood cultures, there was no bacteria in the body. No bacteria in the body. Then they said, oh, this is a very, it's just like AIDS. This is immunodeficiency syndrome. This is like AIDS. So people were dying because to save somebody, there must be some pathogen in the body. There must be some pathogen in the body. So I've seen lot of reports in the hospital which were totally clean. There were no pathogen, nothing, and people suffered from acute respiratory distress syndrome and died. And these fellows, they'll start nebulizers once the people start coughing. They won't let the phlegm come out because they can't let the person suffer with coughing throughout the night because it is so deadly.
Yeah,
And
yeah,
they don't understand. that if they're suppressing, if they're giving nebulizer and it is settling that phlegm, that mucus endotoxin inside the lungs, where is the way out? Slowly, slowly, all the alveoli are covered and the person is suffocated to death. So this is how they are doing, and what homeopathy does, it supports the inflammation in the very mild and beautiful way. That why we take LM potency. LM potency supports inflammation, ascension inflammation in a highly dynamic way without homeopathic aggravation. That if I will give you it in 200 and you will get 6 loose motions, but if I give an LM potency, might be you will be treated in 1 loose motion only or 2 normal stools. This is how beautifully it works.
Yeah.
So this is how homeopathy works. It works to, help or guide our basic defense mechanism or healing power of the body. Wherever heat is required, it will produce heat. If phlegm is required, it will help you to get all those things. Like in choleric people, it will help you to produce those hormones which are not being produced. So homeopathy is so beautiful. It touches you at those points that required inflammation, which is healing in nature, will come beautifully in the required intensity to help the person. So this is what I try to explain through different things.
And you are working in integrated hospital, right? There is
it's not an integrated. I am the one who pushes all the time. A lot of doctors, they took medicine from me during that time. So I know a lot of people. So
other system of
are
treatment also there, no? So
yes, and they just yes, but I have to always volunteer that I can do this. Then
but
there is lot of pressure, then there is lot of pressure because every time you're not able to do everything because you don't know which patient is coming in what complex disease state. They have to die, then they have to die. You cannot do anything when the disease, because anyone is also stated.
But I'm appreciating your courage to say all these things, because you are working in an integrated hospital and you can convey more than others, because many of homeopaths know know this, but no one is saying outside. No one is.
I'll tell you, I have not taken any vaccination. I was working throughout that time, and I was going to the hospital, and I just told everybody, whosoever feels that he's going to catch this COVID, come to my room. My room is no COVID zone. I'll save you. And people used to come to my room and they used to feel better because it is all in mind. And I was sitting at my clinic also, and a lot of my patients are coming coughing and fever. Nothing happened to me because I believe nothing is going to happen. And August, we all get viral. If I get viral fever, I'll take some medicine which is required. Nothing will happen.
Now, Dr. CJ Varghese, he joined now. Next Malayalam session is going to. Have you heard of Dr. CJ Varghese?
GNM.
Yeah.
Germany medicine. Yeah, I totally believe in that. I'm treating patients. I can share a lot of things that when I tell patients in the hospital. So what happened? This kind of situation was suddenly in your life. They say, are you an astrologer? Do you know us from some place? Sometimes people, females used to come with breast cancer, and I used to ask, so how many children you have? Is the younger one more troublesome? Is he a cause of worry? Then she'll tell me, yes, ma'am, I was never able to conceive. Then I adopted this child, and he grew up to be very, spoiled one. He has not read. He has got tattoos. He drinks a lot. I am after his life to make him something. Now I have suffered this.
And Dr. CJ Varghese has shown the courage to hug COVID patients. He established like that. Then very opposition came against him. He's now he joined. Dr. CJ Varghese.
Okay. So my salutations to Dr. Varghese. He is doing a wonderful job.
Yeah.
I've attended his seminar in Delhi. He came to South Delhi Homeopathic Medical Association, and I was introduced to German New Medicine through him, and I think it was a blessing.
Doctor?
to understand and know this.
Maybe he's-
Thank you, Dr. Ajini, for inviting me. And it was a pleasure to hear from Dr. Today's guest that she remembers me when I was. You can hear me now?
Yes, 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 sir.
And how she is taking German new medicine as something important. I don't know how far she has learned it, how much she is encouraging, how much
Sir,
space.
please open your camera also, sir, so we will have.
Okay, I hope you can
Mini-
see me. You can.
Mini, please open your camera. When Dr. Srijavag came, now you are Dr. Mini.
So I didn't hear her presentation, and therefore I have limitations to comment on her talk. Only thing, when I entered, she was giving a very good lecture, and
Yeah,
it was a pleasure for me to know that she attended my national seminar in Delhi. Yes, it was conducted by Dr. Wahi and his team. I didn't recognize her face, whether she was there or not. Anyway, thanks to
What
Dr.
happened? Please open your camera. She was talking here, and I don't know what happened. She muted.
Maybe because because I entered.
No, maybe because she got some call or something like that. Because this one also mute. Dr. Mini. Yeah, she's here. Please unmute yourself, doctor.
I'm here. Yes. Sir, I attended your seminar and Dr. Wahi arranged it and we benefited a lot from it and I explained it to my patients also and I'm working with cancer patients and it is such a truth I can't tell you.
But it took a lot of time for others to recognize its importance. And I hope from now onwards there will be a total change in the outlook of the doctors here. And once they are convinced about the truth that revealed very late to the world by Dr. Ricky Hammer, and this is going to make a paradigm shift in the outlook of the not only the doctors but the whole world. Okay, that's my hope.
Yes, sir.
Do you know anyone other than yourself who has picked it up and encouraging it or nurturing it, giving water and manure and so that it may grow?
Sir, a lot of people who have attended your seminar, they tell that we are not sure that what medicine we will select, but we just try to explain, listen, this has happened to you because this was the situation. I will tell you about my patient. She was suffering a lot of problems. So and then I told her, look, I'm giving you medicine, but the thing is, you're suffering because you're not unable to earn whatever you are expecting, and your mother is not taking care of your child. Suddenly, she has told you that she will not take care. So you just solve this, everything will be fine. And then next day she said, my heel pain is fine. Now I'm able to stand. Now I'm able to go reach. Your medicine is wonder. And I knew that it is not medicine. I made her realize, and right from there, it started.
Wonderful.
So,
And today is the first time that I am going to present on the platform of IFPH on this topic. Earlier I had been there, but today I got a chance and I am going to present from 9:30 onwards. You are also welcome, but unfortunately
in Malayalam, in our local language, he will take the other classes in English also. So that time you
no
can
problem,
join.
sir. I'm in the group. I keep on reading things in the group which other people also send. I'm in the GNM WhatsApp.
So you learn it
Okay.
well, talk to others, give to them, and encourage all of the people, all your
Sure, sure.
friends. Well, it is not a science for the doctors. It is also for all the people, from child to old people, and it will be very beneficial. What we usually say is that learn swimming before you fall in deep waters. Because at the time of falling in deep waters, what exactly is meant by JNM people when we say is this, that many people are, many including homeopaths are affected by diabetes, that treat for prostate, thyroid, all so-called diseases without understanding what exactly happened with them. There may be kidney patients. I know people who are doing dialysis. They go for surgeries without not knowing what exactly was the problem with her. Then.
Yeah. And any participants have question means you can ask to Dr. Many. Then while she's conveying her message, I was thinking, okay, maybe she know about GN.
It was an intuition.
Yeah, I guessed it. Then I asked her. Dr. Ram Parvesh Shah. Oh, I'll unmute you.
Oh, thank you, Dr. Anjani, and congratulations, Dr. Mini Mehta. Very good lecture, subtlety, mind, body, and vital force. Mind, body, and vital force treat the patient nor the disease. According to law of homeopathic science, I am treat the vital force. Vital force increase according to homeopathic medicine. They are similar, similia silvus curentia. The similia silvus curentia, similar in disease and similar in medicine and similar in vital force. So main cause of disease, according to law of homeopathic science, dynamic, and sick vital force, deranged vital force, sick disease produce. So vital force is the dynamic and homeopathic medicine is the dynamic. So susceptibility according to disease, according to patient, according to, so very good lecture, Dr. Mini Mehta, and dynamic person in IFPH. Yes. So very thanks, Dr. Mini Mehta. Thank you.
Dr. Mini Mehta, are you here?
Yes, I'm here.
Because I'm not seeing you well.
I'm here. Actually, I was earlier I was in through my laptop, and
Yeah.
now I'm through my mobile because I have to close my clinic, and now I'm heading back home.
Oh.
Okay, now
That's
you're
why.
on the way to your house, home, huh?
Yes.
Okay. Okay, if anyone
So,
have questions, please
any more
ask.
questions? Anything?
Actually, we have 10 more minutes. If anyone have question means you can ask.
Everything is clear. People are very smart. They have no doubts. Or whatever I spoke, nobody understood anything.
Okay, Dr. Boblim.
Hello. Yeah,
Yes.
I heard somebody call my name. Ah, thank you, Dr. Ajini. You always remember me. Thank you. And Dr. Ram, I like your smiling face too. And thank you, Dr. Minimeta, for a very good explanation according to experience. And I fully agree with you that you don't stop the fever when there's a fever.
Yes.
According to levels of health,
Yes.
by the hospital doctors, so there are obstacles of health like antibiotics and all those conventional medicines that could prove to be an obstacle to
Yes.
uh,
Obstacles to recovery.
yes, to recovery, to the healing process. Right? Yeah, I agree with you.
Yes.
Thank you very much.
Thank you. Thank you very much.
One more thing, I observed that during the COVID cases, when a diabetic is admitted positive for COVID, it seems that their blood sugar level shoots up very high. Have you experienced that before? And what do you do
Sugar
about that?
levels.
Yeah.
Can you please repeat?
Uh,
Can you please repeat?
okay. During the COVID period, there was a diabetic patient. She was tested positive and admitted to the hospital for COVID. And when they did a blood test, her blood sugar is extremely.
So when I'm treating somebody who's suffering from COVID, so that time also whether he's suffering from high sugar levels or high thyroid levels or whatever, or high CRP, D dimers even were so high in thousands, more than 5,000-6,000. The totality of symptoms which you catch just by looking and asking the patient will decide the medicine which is going to take that patient outside from that disease. I have treated a lot of patients who had so much raised D dimers and so much inflammation, CRP levels, and sugar was also high. And in spite of taking oxygen mask, they were having 50-54 SpO2. And if the symptom totality was matching to Crotalus horridus, when I started giving Crotalus horridus, then the patient will come out of a phase in a week. Then again symptom totality, medicine change to Kalicar, again patient will come out of it from the most severe symptoms, and you will see the patients, all the parameters of the patient will start to improve when you will put the right remedy. So whether patient is having high sugar level or not, the right constitutional medicine, which is the most similar in manifestation, is going to bring out the patient in a beautiful way, that everything will be settled. Sometimes the people who used to take a hypertension medicines for hypertension and sugar, they after getting better from COVID, there was no requirement of taking those medicines.
Oh yeah.
So because people will. Someday I will try to share cases. I have cases. I treated a lot of people online also, so I have total data on my phone. So I have all the pictures, how they were, what was the SpO2 and what were the reports, and people spitting out blood. Even the right remedies, they just took them out of it. I used to ask, "Kya soch rahe? What are you thinking right now? What do you think? You will be fine or not?" Some people were fearful. Some people were in delirium. That was also a symptom.
Yeah, anxiety always because of the high level of a high blood sugar or hyperglycemia, and the normal medication for the blood sugar doesn't bring down the level. It still remains.
It doesn't matter. It doesn't matter. Whether sugar was high or not, or what the pathology, when you take the totality of the symptom, it will make every parameter fine.
Yes, that's right. In that case, I prescribed homeopathic medicine. Homeopathic medicine for her to help her, and she was discharged and become well again.
Okay.
regardless of the sugar or hyperglycemia. You are right. I
Mhm.
agree with you. The homeopathy can play a big role in this case.
Homeopathy can play a big role, but homeopath is a doctor who cannot earn without investing himself into the patient. He has to ask, he has to take details, he has to be updated with the medicines which could be similar. He has to read. You know, it's a homeopathy is a zone where a physician actually works really hard. And he has to develop that skill and art and totally be into it. Hats off to Hahnemann, how he was able to, do this drug proving also, materia medica formation, everything, experimentation, laws. What a brilliant man he was. What a brilliant man he was. People say that we want to modernize homeopathy, do research in homeopathy. I want to just try to understand at least what he did. Try to imply what all he did with even with 10, 15 medicines. Explore their area, work field. Then only you see that we want to change. Hahnemann would have changed what he wrote. So this is very beautiful. I would like to say naturopathy, Ayurveda talks about preventive medicine, and homeopathy comes when the inflammation sets in, and or you have tendencies of disease showing up into your body, and then those inflammations are sought out in the best way through homeopathic medicine only. So this is what I say, because they work on the susceptibility, and if you have good susceptibility, this means you have a good immunity. And this is how we can say that homeopathy is the best medicine working on immunity, because you are able to adapt well through the changes. Anything else? Any doubt?
Thank you, Dr.
This
Bob.
is what I know.
Thank
I
you,
can
Dr.
share.
And whenever we are saying this kind of information, people generally human beings have some fears. That is fear of death, fear of health, fear of loss of love, like that. So that kind of fear, uh, if they are listening this kind of information, even though that
Hmm.
that kind of fear triggers them. Otherwise, some
So you have
people
to.
are.
So, ma'am, you have to catch that fear. Like if you will see a stramonium and he is suffering from COVID, he will be high fever, and that time he'll be praying, and he'll be positive, and he'll say nothing will happen to me. My God is with me. Cantheris will say, I will never go to
During
the
the
temple
COVID
again.
time, during
Yes.
the COVID time,
Oh,
that
they were
happens.
praying. They were praying. You can see Calcaria Cobb easily. Calcaria Cobb is remembering his guru. He want to refer to that same doctor only who used to protect and treat him in the childhood. So these are some particular things you should know about the personality traits which come out when somebody is actually sick. Lycopodium will show lycopodium traits. ISMS will show, oh no, this allopaths will do something wrong to me, bring some natural medicine to me, bring herbal tea to me. Lachesis and ISMS will talk like this. And ISMS and Legacies will say, they have done something to me. I was better at home, but when I came here, then only they did something. They do nothing. Brainia will say, Are, please take me back home. If even I have to die, I will die at my house. I don't want to be here. Take me out. Just go somewhere. I don't want to be here. So you will see people talking something, or their body speaking out something, their sweats, their body position, they are sitting, they're straight with straight back, or half they are lying down, or somebody is not able to lie down, somebody's lips are telling something, giving indication to some remedy. So you have to be by the bedside, and it will give you many things.
Thank you,
If
Dr.
it is a
Meeta.
treatable
Thank you
case.
so much. We will have a discussion, this kind of discussion we needed. We will have a discussion again. Thank you so much for on behalf of IFPH. Now we are moving to the Malayalam session. I'm inviting Dr. Anish for moderating Malayalam session. Thank you, everyone.
Okay.
Right, bye-bye. See you tomorrow, same time.